This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to explain how to fix shoulder blade pain. So when I'm talking about shoulder blade pain, it's kind of pain right in the middle of your back. If you could kind of reach around towards the back and kind of push at it over the top, that's the pain where I'm talking about. And a lot of times that will be kind of confused with back pain. Somebody will go to see a chiropractor, but it's actually coming from the shoulder blade. So your shoulder blade or scapula is it's a pretty complex bone, and it has complex movement. It works together with the shoulder to provide movement to your arm, and it'll often kind of do this kind of movement gliding along the ribs. And there's actually 17 muscles that attach to your scapula. But what can happen is that if you develop shoulder pain, let's say bursitis, rotator cuff tear, or something like that, your shoulder blade will start compensating to get that movement. And what ends up happening is it throws off your whole biomechanics, and then the shoulder blade is not gliding right along the ribs anymore, and it kind of starts moving all herky-jerky, and that can cause pain right around that area. Sometimes that pain can get pretty bad and actually could develop bursitis underneath, because there's a bursa underneath the scapula, and that's called subscapular bursitis, where it gets really painful. But this is something that can often be missed because people either tend to focus on the shoulder, they tend to focus on the back. I mean, other doctors, when they see you, and they'll kind of ignore the shoulder blade, but it's certainly a part of shoulder blade pain. So the question is, what do you do to get rid of it? Well, the best thing that you can do is, you want to take care of whatever's causing you pain in the shoulder. That'll help. But even if you take care of all that, your shoulder blade still will probably be moving funny. So you want to do physical therapy that focuses on periscapular stabilization. The goal is to make it so that both of your scapula are moving normally, and one is not kind of clunking around. And the goal is that they have you hold a broom and move your arm in different sort of ways, and it retrains your body and mind to get the shoulder blade to move normally. And that's really the best treatment for shoulder blade pain. You know, because pain coming from your back in that area, it's a thoracic spine, it's a pretty stable area of the spine, and not normally a big source of pain generation as compared to the lumbar spine, which has a lot more movement, or let's say the cervical spine. Sometimes if someone develops a subscapular bursitis and the pain gets really bad, I'll actually give a cortisone injection to that bursa underneath the shoulder blade, and that tends to provide pretty immediate and lasting relief, although they need to combine it with physical therapy to get the biomechanics back. So, periscapular pain or shoulder blade pain, not super complicated, but if it goes unnoticed, you'll have it for a while. So again, to summarize, physical therapy, periscapular stabilization, make sure also addressing the pathology in the shoulder. If that doesn't get better, then you can consider a steroid injection as well. This is something that hardly ever needs surgery, at least in my hands. I hope I was able to answer your questions about how to fix shoulder blade pain. If you have any questions for me that I didn't answer, feel free to leave them in the comments below. If you like this video, we put out new content every Friday, so please like and subscribe, and thanks for watching.